The Philippine Nurses Association of Nevada now brings you FILIPINARS, news, interesting features, and events in the nursing community and beyond. Hosted by Doris Bauer.
Good evening, FILIPINARS listeners and followers. Magandang gabi po sa inyong lahat. Here we are again for our weekly program. And as you know, FILIPINARS is a public service project of the PNANV, or the Philippine Nurses Association of Nevada. I am your host, Doris Bauer. And of course, this program is brought to you by PHLV Radio every Friday at 7 p.m. and is simultaneously broadcast on Facebook. So thank you so much for joining us today. Well, today we are going to talk about telehealth for mental and behavioral health during this coronavirus pandemic and what one organization is doing to help the community to help cope with mental health struggles. So statistics show that in 2016, more than half of the 44.7 million adults in the U.S. with mental health illness did not receive any mental health services. 1 in 10 of our youth has a mental health problem. 13% of children between the ages of 8 and 15 have a diagnosable mental disorder in their school years. But there are also a lot of barriers to accessing behavioral health services across the country. For example, individuals residing in the rural areas could face challenges which include having to travel long distances. And so there's also the lack of anonymity in receiving treatment. And these issues are made worse with inadequate funding, the lack of specialty services, and the lack of healthcare professionals in this field. But there is also evidence that telehealth can help to overcome the challenges in accessing behavioral health to reduce the existing treatment gap with positive health outcomes. And so telehealth could help address this issue by providing services through video conferencing, like what we're doing now, and allowing the individual to remain at home or in another space where they are comfortable. So there is an organization in our community whose objective is to provide mental and behavioral health services to the Clark County School District students. And they have programs for many underprivileged and underserved families who reside in the Las Vegas area. And they have stepped up to the plate to help the community during this coronavirus pandemic. The organization is called United Citizens Foundation, or as we will call it, UCF. So for today's program, we have 2 ladies from UCF who will talk to us about mental health and telehealth. So please welcome Ms. Sherry Exber Brown and Nancy E. Adams. Welcome, ladies.
Thank you
Hi.
for having us.
Thank you very much.
Thank you. Okay, well, I'm going to do a little bit of an introduction for you guys and feel free to add to it, okay? So Sherry Brown is the Director of Development and Community Relations for the United Citizens Foundation in Las Vegas. She is responsible for the organization's awareness in the community as well as donor relations. And before joining UCF, Sherry was the Senior Vice President of the Public Education Foundation, where she was instrumental in fundraising campaigns, creating awareness over a 13-year period. And Sherry is an elementary school teacher. That's great. She has a bachelor's degree in elementary education from UNLV. Anything to add to that, Sherry?
I think you hit it all, other than I love hiking, spending time with my husband, my children, my granddaughter, and my golden doodle.
Oh, your golden doodle. Yeah. Love those dogs. Okay, thank you. And Nancy E. Adams is the a clinical professional counselor for Las Vegas. And although she works predominantly with children and adolescents with a keen focus on how they were affected by trauma, Nancy has spent several months in the University Medical Center, UMC, of Southern Nevada as a volunteer crisis counselor for the hospital staff that was affected by the October 1 mass shooting. And it was during this time that Nancy was recruited to help establish the Nevada Youth Suicide Prevention Task Force, where she served as co-chair in 2019 and will be the chair for 2020. That's great. Thank you for joining us today, Nancy. Did you have anything to add to that?
No, but well, yeah. Hiking is a big deal for both my wife and myself, and we have a brand new granddaughter. She's actually not brand new; she's about 7 months old now, and they live in Colorado. So, but no golden doodles.
No doodles.
Okay. All right. Well, feel free, ladies. I have a series of questions for you, and I know Sherry, you can answer some, and Nancy, you can answer some of them. So, but feel free to interject, okay, to each other.
Sure.
So let's start with what is the United Citizens Foundation, or UCF, and what is its mission?
So, United Citizens Foundation is a nonprofit organization. And our mission is to support, educate, and provide mental health and behavioral health and substance abuse services for students, families, and our community, regardless of economic status.
Okay, correct. So what is the history behind the organization's formation? Why mental health services?
Well, so the president and CEO of our organization, Ash Merchandani, actually started United Citizens Foundation in 2010. He just wanted to give back to the community in some way. He came here with his wife from India and felt as if he was living, you could say what he told me was the American dream. And so he started doing health fairs and food drives and trying to do different things in parks and in rec centers to help the community. And after a couple of years, it just turned into realizing there was a definite need for mental health. I know he was working with some politicians back in 2000, like I'd say 13, 14, and realized the need for mental health and started to put the school-based program together because he got in touch with CCSD, with the Special Children's Services over there, and they found that Valley High School was in dire need of the service. And so working with the principal and the school district and Ash, they were able to put the first school-based mental and behavioral health clinic on campus.
Okay.
I would like to add though, just knowing Ash as an individual for the several months now that I've worked for UCF, it's just, he's very philanthropic and has a fabulous vision. And that's really something special to be a part of.
Definitely a visionary.
Yes, he is. I had met Ash several months ago, and he's very active in supporting the Asian American population here. So that's actually where I met him. So, hi, Ash. Okay. So what are the available services of UCF?
So United Citizens Foundation, and I know Nancy will probably chime in as well, we basically are providing, mental and behavioral health therapy, whether that would be in schools, because our model really is school-based, or in one of our offsite clinics, and of course now through telehealth. I think Nancy might be able to speak a little bit more to the service, actually.
Okay. Go ahead.
My home office, so to speak, is at Valley High School, and the kids just, when they're scheduled, they just come straight to my office. We schedule them at the beginning of periods. So, and the teachers are on board. The principal and the vice principal are both extremely supportive. I can only think of two maybe 3 conflicts where a teacher needed a student not to miss that class. And if that were the case, then we just moved that student. And even then they're extremely supportive. But they come to my office, we meet for 45 minutes, just as if they were to come to one of our offsite clinics. And the procedure, the therapy, the relationship is identical. It just happens to be done on the school.
So why school-based? What's the importance of that, and how does that work?
The school-based is so important because there's so many families that can't get their children to therapy after hours. They might have to work, or the kids won't be interested. They're tired. There's more than one child in the home. And this way, parents come in, we do an intake with parents, gather all the paperwork and necessary information. And except for, a 4 to 6 week conversation with the parents, the kids are on their own. And by on their own, I mean responsible for getting to therapy, and they don't have to rely on the bus or a parent, or they have to babysit for younger siblings. So it's so much better. And so many things that happen in school can be taken care of in school. By the time, parents don't have to be, you're going to be punished for this because you happen to do that. And we work right through it, shortly after the moment.
It also, removes a lot of the barriers. I mean, it's accessible, it's convenient. I believe it increases some academic motivation to a degree. It's a safe place for them. We're hoping that it diminishes the stigma associated. I mean, Nancy knows all. And it's a safe environment, I think, for them in school. So that's part of, our model.
Yeah, your model.
It is
that's awesome. How many school-based programs do you have right now?
So currently we're on 5 campuses, or we were on 5 campuses before we moved over to the telehealth platform. But I will tell you that we have phone calls often from principals and administrators asking, how do we get UCF on our school? How do we get you to come to our school? And it really boils down at the end of the day to funding. But I know the need is there. It's great. I know after having taught 20 years in the school district myself, looking back, and it was a long time ago, wish we had it,
Yeah. Okay, so what types of employees do you have at UCF? Do you have any volunteers?
So to be honest, we really don't have volunteers at this point. We kind of thought about planning some type of walk for mental health where we would have needed volunteers, and I was kind of planning that out, but not currently a lot of volunteers. There's a lot, with the HIPAA compliant and those kinds of things, we have to be really careful who does do things or work with us or for us, because we all have to follow that guideline. But we do have an intake staff. We call them school and community liaisons. And what they do is help spread our word. They help set the appointments up for the clinicians and kind of keep track of referrals and, basically do the intake process. And then we have our clinicians, and we have an office manager and me in development. So it's a very small, we're very small, small and lean.
Yeah, small and lean. Okay. Okay. Well, before we discuss go into the nitty-gritty of telehealth and with Nancy, now UFC is doing, UCF, I should say, United Citizens Foundation is doing something for the community during this coronavirus pandemic. Can you tell us what that is?
So what we are doing is offering the service with no out-of-pocket cost. We don't say no. We don't turn anybody away, regardless of their economic status. And the way we're able to do that and sustain our program or our organization is when we have someone who's underinsured or not insured for whatever reason that may be, we build a grant because we're funded by a state grant.
Okay.
When we have someone who's insured and we're on the panel, we're credentialed with that insurance company, we can then bill the insurance, but we don't do any copays. We don't take copays at schools. We don't take copays in our office. So that's how the model works. That's how we make it work.
That's great. That's fantastic. So what insurances do you take? And do you work in collaboration with the state of Nevada or community agencies?
So we do work with the state. We get a lot of referrals from the rurals. We get referrals from other agencies, which I'll talk about in a second. But some of the insurances that we do accept are the Medicaids, Fee-for-Service, Anthem, HPN, Silver Summit, United Healthcare, Sierra Health PPO, Medicare. So, and always trying to get credentialed with as many as we possibly can. We also work with the Harbor, so with the juvenile justice program. So those kids, before maybe trying to keep them from the pipeline, we get referrals from the Harbor to see those clients. And we work with other agencies too. We, we're getting our word out with Three Square, United Way, Safe Nest, all those different type of agencies to let them know we're here. We can help you.
That's great. That's great. You got a big job ahead of you, huh? So Nancy, you see people in the clinics, and you do have 2 locations, one at the Buffalo Drive location and one in North Las Vegas. So in your clinics, what types of mental health and behavioral problems do you mostly see?
You know what? There's such a variety. I'm not sure that there is a mostly. There is a lot of depression and anxiety and PTSD. Right now, I'm seeing clients solely teletherapeutically. I don't have any clients. I've moved any clients at all at North Las Vegas, which was where I split my time between North Las Vegas and Valley High School. But now I'm strictly teletherapy. And there's 2 different kinds of therapists. There's top down and bottom up. Top down teaches coping skills and what would you do if, and how can we prevent this again, those kinds of things, anger management. I'm a little bit different, and I hear that from my clients, but I assume every single one of my clients has some sort of trauma, which has changed the lens through which they view their world. Mm-hmm. And the smaller their lens becomes, the less ability they have to see anything that supports their negative. So we work really hard to expand the size of that lens, give them a different perspective, different worldview, and learn to understand what caused that and what supported that in the first place. Then, by the power of magic, being silly, but the coping skills necessary, the anger management skills necessary, they just kind of fall off. It's not, you don't need that, and I know there's not a kid in this world that wakes up every morning and says, what teacher can I just make miserable today? What can I do to ruin everybody's life? This kid wakes up in the morning and says, I'm gonna be okay. I'm gonna sit in my seat all day and I'm gonna do my homework. But by the time he gets down to breakfast, he's had a fight with his sister and he's kicked the dog and he's thrown a bowl of cereal across the room. And often, like most often, he does not have control over that. So instead of, okay, here's my kid, fix him, like what happened to him? How can I help you with that? How can I make you understand, or how can I assist you so you understand that I don't blame you, that I understand that you don't have control over this and that you want to. And it just goes from there. Okay.
Now, do you see mostly the pediatric population, or do you see the adult population as well?
The majority of my clients are high school students. because I was located at Valley High School. I have a couple of younger ones, siblings of the high school kids, and I have 2 elementary school students, and probably 4 or 5 or 6 new adult clients that I've met solely through teletherapy. My high school students, most of them transitioned with me into teletherapy, and and it is so different. It's a whole different world, teletherapy rather than face to face.
Yeah. So the adults mostly, they have anxiety, depression as well.
They do, but I approach it the same way. That they were, a 6-year-old, and there was a monster under the bed, and the monster got ignored, and so I assume that they have had some sort of trauma as well.
Okay. So tell us about telehealth services for mental health in general. And have you found that telehealth services is effective, especially during this pandemic time? And what are some of the mental or behavioral issues that you see in telehealth?
So right now, I'm working with several students that are dealing with some form of anxiety or depression, several with PTSD or symptoms of PTSD. And if we hadn't had face-to-face for so long prior to telehealth, I'm not sure it would go as well as it does. Just this week, I've had 5 or 6 kids tell me that they feel very lonely. And that was a surprise. And the timing of it, none of these kids know each other. Well, they might, but they don't know they know each other through me. And it was really eye-opening that right now, and as we're into about 4 or 5 weeks, that they're starting to feel lonely and disconnected, even though they spend their world, their time in an online platform with social media. Now they're really starting to feel the loneliness. So it makes it more it's more necessary that I investigate suicide. I ask every student, I ask every client every time they come in, what's your level of suicidal ideation? And you can have a level of 10 and no intent and no plan. And let's talk through what is causing you to feel like, you don't want to be here anymore. And then sometimes it's drama, and sometimes it's pretty serious stuff. And I work with students with homicidal ideation. I had one student who was at a 10, had a semblance of a plan if everything would come together. He's now to 0, no plan, no intent, and no desire. And I mean, that doesn't happen a lot with homicidal.
That's great, though. That's
pretty awesome.
That's awesome.
Your run-of-the-mill depression, that kind of thing.
And this pandemic, you think maybe has increased those ideations or feelings?
I haven't seen a lot of direct correlation from the pandemic, honestly. They're annoyed that they can't be in school. They're annoyed that they can't go out. But they're not scared. They don't seem to be scared. And even when, how I question them are, well, what if this or what if that? A couple of the younger ones are concerned about grandmas and grandpas, but most of the kids like, I stay at home anyway, it's no big deal. But they're starting to feel the loneliness.
Yeah.
And so that's not something I expected, but something that definitely requires a lot of attention.
Yeah. Okay. So what are the advantages of telehealth? And would you prefer a clinic visit or a telehealth appointment?
Honestly, I would prefer face-to-face. However, I need to set an example for students and clients as well. If I can't be flexible and make this work, I can't expect them to do the same. But there is a difference. There is a difference with the face-to-face. It's so intimate and it's so powerful that, we have we're removed from one another through teletherapy. Yes, it is beneficial. Yes, it offers so many things that they wouldn't have otherwise, but it isn't face-to-face. And, those moments that a client experiences, the breakthroughs and the insights, and you get to see that and feel that, you can't explain it. And those are moments that belong solely to the client. And, they can be reflected between myself and the client. But there's a difference with tears, and there's a difference with laughter, and there's a difference with comfort and pain and regression and success and vulnerability. And in teletherapy, I can't offer a tissue. I can't say, "Hey, can I come and see you?" And I can't offer a hug. And there's nothing more powerful and more important to me than the therapeutic relationship. And if the client can't trust a clinician, they're not going to go anywhere. And I honor that with every bit of counseling I've ever done. Is the therapeutic relationship is the most important thing.
It's the most important thing. So, okay, so those are some of the, in your practice, you think that, you'd like the clinic visit. If I were a therapist, I probably would, prefer that myself. But when do you think telehealth is not effective? What situations or?
Absolutely. Active psychosis and active addiction. When someone's in an active psychotic episode, there is no level of reasoning through a screen that I can get them calm. And, we have to be able to have instant access to somebody to hand them off to, which takes time. I look up, the ROI and get the emergency contact and call them and let them know. But an active psychosis this is not the place for it. And if somebody's actively suicidal or actively homicidal, which means their ideation is at a high level, it could be 6, 7, 10, and they have a plan and they have the intent. And they may share that through teletherapy, but we can't instigate a suicide protocol at the school. We can't, it takes time, like I said, even if it's just minutes, to get the person to whom I would hand off. So, fortunately, I haven't had that. I have had a lot of students that, disclosed that they were very suicidal, and, we've been able to walk through it and do a safe handoff.
Oh, that's so great. I think, Sherry, you sort of answered this a while ago. How do you get your referrals? And I know, I guess now telehealth is now paid for by insurance, correct? So
the telehealth is paid for either through insurance or through our grant. So we either build a grant or we build the insurance. Getting referrals, there's a few different ways we get those. When they're school-based, we get them from the administrator, we get them from the school counselor, we'll get them from the school social worker, the nurses, teachers. Then we also get them from the harbor. We get them from the state. And with that being said, I guess a real positive thing about telehealth is that we're able to accommodate the whole state of Nevada. We can see clients in the rural communities that don't have the access to a mental health agency. And so that's a big thing for them and for us. But as far as referrals, that's how we get them.
Okay, great. So Nancy, with your involvement in the aftermath of the October 1 shooting, are you still finding some long-term effects of the incident among our community and our mental health patients?
Personally, I have not, predominantly because my population of choice are those under the age of 18. And while I was there, I was able to hand off to the EAP department or different agencies. I did a lot of work with the Resiliency Center. I sat there one day a week and did some crisis counseling there, and then they would refer to different agencies at that point. So I didn't carry on or take on personal clients from that. It was just kind of one or two visits to deal with that acute stress that they had to understand it so they could get back to work.
Okay. Yeah. All right. Good. So UCF is a not-for-profit organization, and you did say that you had grants. You also rely on donations, and do you have any fundraising efforts?
So we do. Part of what I do also is try to put some public-private partnerships together. I mean, we're mainly funded by our grants from the state, public grants, but getting some private ones is nice. We haven't gotten very, very big ones, but we've gotten some really good ones. We've got like Brady Industries gave us amenities, and we can give those to the kids in the schools and the families. We got one from Ocean Spray. We got one from Dermody Properties, which allowed us to decorate some of our therapy rooms to make it a little more conducive to the therapy that is going on. And then, just trying to make relationships with some different businesses in our city, and giving tours when we could of a school-based site, hopefully would pull at the heartstrings a little bit to get some donations, but would be very interested in anybody wanting to give to the organization financially, because there's a lot of different pockets that we could put those dollars, to work.
Use. Yeah. Oh, great. Okay. So can you mention some positive feedback or success stories regarding UCF and its services?
I know Nancy probably can talk about some success stories and stuff, but what I really want to say is, we are here for you. If you need us, please let us know. Our number is 888-6300, 702-888-6300. We'll make sure we get you scheduled and seen right away.
Yeah. Okay. Nancy?
Yeah. Yes. The biggest success is when, I'm working with someone who is in an active major depressive episode, with or without psychotic features, and watching them come out of that and understanding the difference between their now and their before. It's absolutely amazing. And I have several students that are on the up with that, and understand that even though the depression has been dealt with and mitigated, there are things like family sabotage and it's more insidious kind of things, and not, okay, I'm going to sabotage your depression now, but it's more difficult for families to deal with someone who's okay than when they were not okay, which leads a client then to think, I need my depression. It was my comfort. I could navigate that. I understood where the sludge and the glass and the mud was, and they don't have as much experience with the clarity and the open ground. So that part is probably the best part of depression. When you grieve and let go of the depression, that doesn't mean it won't come back. Everyone on this planet has a depressive episode at one time or another. We're built that way. Some of us spend days and days in bed, and other of us just kind of go, God, I just feel a little weird. But we all have depressive episodes. So learning what's bringing that on and the signs, yep, it's coming on. I got to do some self-care. And, the face-to-face, my space is clinicians' spaces are safe. Clients can come in and say whatever they want about whomever they want, about me, about their parents, about their siblings, and it's okay. When they're at home, they don't have the same kind of privacy. And when they're young, quite often you have parents lurking. And whiteboards are fabulous. I ask all my, I try to remember to ask all my students if they have access to a whiteboard, because if they don't want to say something, they can write it. I can see it, and then they can erase it and we can work through it. So, I've got students that would come in my office and pick up the same fidget toy or the same coloring book every time. And having that also offers stability and comfort, which is a very important aspect of counseling that we missed with the teletherapy. But other than that, I've found much more success with it than I expected. And it has turned out to be a really great bridge. And there are companies that have thousands and thousands of therapists, and they've been around for several years now. And it's a get in, figure it out and get out kind of modality rather than a years on the couch psychotherapy thing.
Oh, okay.
So, I wouldn't suggest teletherapy for, someone who has complex PTSD or, a lifetime of chronic abuse or anything like that. I do EMDR, and I'm limited in how I can utilize that with teletherapy. And I've got some clients that are already complaining, like, when are we going to process this one? And I'm like, I don't know, but I'm trying to figure it out.
So for our listeners, what does EMDR mean?
EMDR is eye movement desensitization and reprocessing. Okay. And it's, I'm sorry, what?
No, great. I said, yeah.
Oh. It's a modality that simplistically takes your traumatic memories that are in this part of your brain, and they're in the way, and there's a lot of emotion attached to it. There's a lot of negative cognition, the false belief system attached to it. The EMDR, it's almost like a dream state where you have rapid eye movement.
Okay.
And then it literally files those memories and those emotions in the parts of your brain where they belong. You don't forget the memory, but the emotion attached to it is gone. And it is the number one modality for any kind of trauma. It was initially, kind of like for war, people that came back from war and were having a lot of PTSD, but it works with kids and it works with adults. It works. I mean, I follow the protocol with every client. We don't always now do the bilateral stimulation, which is the eye movement piece, online, because it isn't the same.
Yeah. Okay. And the last question for you ladies. What is your message to the community regarding mental health during this coronavirus pandemic?
I can tell you that I have shared with my clients that we are all struggling.
Yeah.
We all need to be transparent about our fears and our concerns. I can't tell someone, oh, it's going to be fine. I don't even tell them that anyway. I tell them it will change. I never tell a client it's going to be okay, because I don't know that. I don't know that this is going to be okay. But if I need to be as real with my clients as I can within parameter, within the safety guidelines, because it makes our relationship more authentic. It makes me a real person to them. And I can't say I don't have any fear, because these kids, they know,
For sure. Yeah, it's affected everyone.
Yeah.
Sherry?
So I was just going to say, the uncertainty is difficult for everybody to process, but it makes me feel good in my role to know that UCF is here. We're here for you. We can see anyone and everyone, and that's the good news.
Okay, great.
Fabulous.
That's great. That's great. So to our listeners, please remember that UCF will be providing counseling services to Nevadans at no out-of-pocket cost during this global coronavirus pandemic. And you can contact UCF at 702-888-6300, or you can just call Sherry or Nancy. All right. And do you have an email can they email as well?
There is an email. It's refer, REFER at UCFNV.org.
Okay. Refer. All right.
Yeah. It wouldn't make sense to give my email address, because I would just have to say, okay, you need to go to refer.
Exactly.
There's a protocol that they follow before a client gets to me, or a different.
And the process would be quicker going straight to refer.
Yeah, going straight to it. Of course. Okay. Well, thank you very much, Ms. Sherry Brown and Ms. Nancy Adams, for coming to our program today. I also want to thank Mr. Ash Merchandani, the UCF founder, and for the news of what you guys are doing for the community, which led me to actually talk to you ladies. So thank you, Ash.
Thank you so much. This was fabulous. I appreciate it.
Thank you.
We appreciate being able to get the word out. We really do.
Of course. And to our listeners, we leave you with this. According to the Psychiatric Times, prior to the pandemic, telehealth, telemental health actually expanded significantly from 2017 to 2019. All the 50 states and the District of Columbia provided some sort of coverage for telehealth services for their Medicaid members. And there are commercial payers now that are actually paying for this, but it varies from state to state. But the use of social distancing to flatten the curve and to prevent the spread of COVID-19 has increased the use of telehealth. Mm-hmm. It has become critical to conduct patient encounters by telephone or video conferencing during the current pandemic, especially as many patients are currently experiencing increased levels of stress and anxiety. And their psychotherapy and psychiatric management must continue even in this pandemic in order to avoid potential consequences like suicide attempts and all of that. So because the face appointments both risk the transmission of COVID-19 and the use of personal protective equipment is in dire shortage, telehealth has emerged as an important alternative. Mm-hmm. So, go ahead.
I was going to say, especially within the first 30 days with the acute stress, we don't want a client to go into symptoms of PTSD or actually PTSD. So within that first 30 days, if they're struggling and they're not understanding why they're reacting this way or that way, or angry with their kids or their spouses, that's the crucial time to come in and just talk through it. 1 or 2 visits might be all that's necessary, so that they can understand that what they're experiencing is normal. Correct. And when we can help with that.
Good. So thank you, Nancy, for that. And we would also like to thank the mental health providers and organizations like the United Citizens Foundation for providing their services, including telehealth services, to this vulnerable population. And please remember, if you're having increased anxiety and stress in these difficult times, please get some help. Thank you very much for tuning into our program and for your continued support. This is your host for FILIPINARS, Doris Bauer, signing off for now.
Thank you, Doris.
The Philippine Nurses Association of Nevada has just brought you FILIPINARS. News, interesting features, and events in the nursing community and beyond. Hosted by Doris Bauer. Fridays, 7 p.m. Pacific on PHLV Radio.